Welcome again to the Medicare Team podcast. This is Joshua Usner here, joined by Mark.
Hello.
We are both licensed agents and we love helping people with their Medicare.
It's true.
So today we're going to be getting into a little bit of home health care, and if we have time, we may go elsewhere. But the main focus of this podcast today is going to be home health care, and we have a article here that we're going to go over as well, just main talking points of it. And how Medicare Advantage companies are actually denying people for skilled nursing care, and what you can do to help prevent that and ensure that you'll have coverage, and how you can appeal it. So,
Yes, this is something that caught my eye just because things that you'll see if you're somebody that's Googling Medicare Advantage. So this is where people can be scared, and for good reason.
yeah, what's the name of the article for people to find it if they want to?
This one is on Medicare Watch, Medicare Rights Center. Medicare Advantage plans often inappropriately deny access to skilled nursing care. Okay, so if you're in a hospital and you're not fully healthy, what it's telling us here is that disproportionately claims are getting denied for that.
Yeah,
Okay, so it would be an advisable thing for someone to look into home health care, because if that's where the insurance companies are trying to steer you,
yeah, you're going to want to have coverage because
right,
Medicare generally doesn't cover home health care services.
right.
So,
So
mhm.
yeah, I mean, work the system there a little bit if that's what they're trying to force you to.
Make sure that you have some type of
See if,
coverage.
you
Yeah.
know, you can get some money back even from that particular thing.
Yeah, it gives you the ability also to recover at home. And this isn't just like if like you're no longer able to do some of your daily activities of living or you have dementia, it does provide some coverage for that. But if you fall down, if you get hurt, instead of being at a facility, that might not be that comfortable, you can recover. It gives
Yeah,
you a daily benefit to bring someone in to help you.
I work for that myself.
Yeah.
I like my couch. I like my own bed. I like my pillow in particular.
Yeah.
As my neck keeps getting worse.
Uh-huh.
Yeah,
Yeah, like the smells of cookies and the other.
yeah, all the good stuff.
All good stuff.
Not having to be around other sick people.
Yeah,
Also fairly cool.
yeah, for sure. Uh, Recovering at home is my preferred method, man. I just lock myself in my room until I get better. It's kind of my way, go caveman style.
Yeah. No, mine was always wonton soup and orange juice. And of course, laying in your own bed or your own couch.
Yeah,
But to like the point of this, though, if I consider myself more of the Robin Hood type of person when it comes to Medicare,
mhm,
trying to help the people
yeah,
get the benefits back to themselves
yeah,
from the evil empire. So this is a way, though, that really caught my interest of seeing things like this that will scare people. My God, they're gonna not let us get care, but
yeah,
not that per se. But if they're forcing you to get home health care, like cover yourself for that.
yeah.
Make it beneficial for you.
What percentage of the show is like? It was somewhere a little under 20%.
I thought
14% were
was
denied.
if it wasn't. So like 95% is for the prior authorization.
That's it.
So that's like going to be the AI thing where they're just blatantly like it's down to like 12%. So for skilled nursing, 12% claims are going to be denied after appeal. And then 40% if you're in a nursing home. So
Yeah,
nursing home, you don't deal with as much.
yeah. But for sure, it's something that you got to look into and always appeal. If you get denials, you call us. If you're working with us, we'll help you call in and appeal. Or you can call the number on your plans ID card and go there and you can ask the customer service, like, hey, why did this get denied? They'll tell you why it got denied. And if it got denied, you can always appeal. A lot of times, from what I've seen, just I've ran our customer service for a little times it's actually the doctors just entering it wrong in the system.
Yeah.
That's the reason why you get denials a lot of times. But make sure that it's not something stupid like that. like call in, and then if it did get denied, find out why it got denied.
Yeah.
And then if they still deny it, then legally they have to get a third party in, that's not affiliated with the company, to be able to do like a review that's not biased. A non-biased review, is this medically necessary?
Right.
And they can overturn it then. So
You-
always
yeah.
appeal your decisions.
You already gone through this with people?
I've never gotten that far before, but yeah, always appeal on your decisions if you're getting denied. So have that. Yeah.
Now that's something we could tell veterans that are having issues with the VA. Because
Yeah.
we're dealing with that now.
Yeah, we're helping our vets out with their Medicare, for sure. And for our vets out there that are listening, we thank you for your service. But the VA and Medicare they're completely separate from each other. So the VA sometimes will require that you have your Medicare active. The coverage itself is separate from each other. So you earn the VA coverage through your service, and we do thank you for your service. Yes.
Well, if we're going into the VA, something else I had learned about, always reading and always keeping my ear open now is DAV. Do you hear about this?
I've not heard about it. Tell me.
Department within the VA. So the gentleman that told me about this went from a 10% disability rating of for people grow to the DAV, Disabled American Veterans Department within the VA.
Why were some reason someone would want? Yeah, if someone's in the VA, sorry for those who are not who are listening that are in the VA, but why would someone want their disability rating higher?
Well, to
It's a lot. Well,
right. That's
yeah, and those yeah, but we do need to pay our vets who have paid the
I agree.
yeah, and service.
Yeah, he said, yeah. 3 to 60, but he's still looking for more because like they're not even factoring like hearing loss that he had,
Yeah.
which is something else that's been pretty common in conversations with veterans over the past few weeks. Tinnitus is something that, and like hearing loss from just being around munitions.
Yeah, for sure. So
Always covered.
if you're served in the past and you have some issues that you think will relate to your service, for sure, go see if you can get some disability rating, because you deserve it. Sidetracked a little bit.
Healthcare. The other cool
It can actually pay you for taking out prescriptions. And by reimbursement, we don't mean just all the money that you've pocketed out of your own pocket. It will pay you $15 per generic and 30 per brand, up to 700 and per year. Which, depending upon your age, is actually going to be more benefits that will also be included. And all you need to do is just every month just take a picture, send it to us, we'll file a claim to get up. It's really easy. It's almost like you're making money there for a little bit off of this plan while getting the coverage.
Oh, yeah.
5-year age gaps. But if you're like 65 to 70, 70 to 75, it's going to pay for itself. So you obviously would have to be taking up prescriptions, or that would happen. But I mean, it's still good coverage to get, even if you are fully able to utilize that if you're healthy. And be grateful that you're healthy. That's a good thing. But yeah, you're saving money off of not having yeah, you're saving money off of being healthy because you're not having to pay for all those prescriptions.
Yes.
Yeah.
That's a selling point for a cancer policy. Someone was like, oh yeah, well, I just don't want to get cancer. I'm like, okay, well, yeah.
No one wants
We all, yeah, if you're going to, wouldn't you like to get money back? And then it's like,
yeah. It costs of cancer.
maybe you get it
as well too.
right. Maybe you don't, but if you're spending $32 a month to not ever have cancer, is that worth it?
Yeah.
Whereas if you did get it, you're going to get like a big check back.
Yeah, for sure. And the younger you get it, the cheaper it'll be for the rest of your life. It's age age rated, I believe is what it's called, meaning just issue age rated, meaning that they charge you at your issue age. So
Yeah.
I got one for myself. And being this young, it was only like $32 a month. And it's going to stay that. It's going to be stay that for the rest of my life. And that's $75,000 I get paid tax free.
You're a spring chicken too.
God forbid I would ever get cancer, and I don't want cancer. So
Well, yeah,
I hope I never have to.
32 a month.
Yeah, 75 for cancer, heart attack, stroke, and critical illness.
Nice.
It's like I said, the younger you are, the cheaper it's going to be for the rest of your life. So if you're like pawning it off, and this is the same with all insurance, whether it's your burial expense, whether you're looking at maybe long-term care at like a nursing facility, like making sure that you have coverage for that, which is one of the more expensive areas that most people don't plan for. But it will happen. A lot of people have experience with this with their family members having to go sell all their assets and apply for Medicaid to get covered at a facility that's a government facility, which a lot of times you don't have a lot of choices there. Some facilities are nicer than others, but yeah, my grandfather's in one. Half the people there care, half the people don't. And a lot of times the floors are sticky, so it's a pretty sad place to be in. So anything you can do to avoid being there by planning ahead when you're healthy is going to be beneficial, because you're not going to be able to get it when you need it. Insurance doesn't work that way. You have to get it when you don't need it for when you would need it. God forbid you ever need it. So younger you are, when you don't need it, is the best time for you to get it, because it's going to be cheaper for the rest of your life. It's going to be cheaper, and more beneficial, as well. So
Yeah.
yeah.
What else is new?
What else is new? Well, we're starting to kick in. We're towards the second part of the year. So the next year's annual enrollment period, I think it's 3 or 4 months now. So we're getting pretty close to that.
Like anything new?
They don't come out with that until October. Yeah, no, Medicare made a bunch of changes for next year on all sides. You can look online and see articles on that if you're more interested in the more detailed technical side of Medicare and the Center for Medicare. So
Who is it?
CMS and how all the changes are. So yeah, but yeah, there's been some changes for next year, for sure. And I'm sure we might do a podcast episode when we get closer to that time, going over maybe some of those changes, as well. So that was a random sidetrack here.
Yeah. Fire alarm control sometimes. We get excited to talk about Medicare. Yes, I keep seeing different things about new regulations.
Yeah, I heard that like some type of like they're looking at doing some prior authorizations and stuff on like original Medicare and Advantage. So we'll see. They're talking about that. I don't know if it's actually gonna be a thing or not. So
Yeah.
okay. Yeah. For some services, but we'll do a more dedicated podcast episode. I'm sure sometime in the future. I will want to get educated on that before So cancer, heart attack, and stroke, we're talking about that a little bit earlier, but Mark, why would you want to have that coverage? You, myself, me, yourself, and anyone who would be watching, like why should I even care about that if my Medicare plan is going to take care of it?
Well, it's not.
Yeah.
Your hospital bills are getting taken care of, but if you're having to get treatment, it's going to eat into your savings. And if you're not working during this time, you still need money to live off. It's your last days kind of thing. Maybe just go use the money, have some fun.
Yeah, you can go to Disney. Like you can like that check gets now tax free, and you can deposit. You can use it for care, whatever you need, or if you're at the point where you've lost hope, just enjoy the rest of your life with it. So yeah, it's just something good to have on distant days.
Yeah, that's not something anybody wants to think about, but popped up on me because somebody texted me and said, "Okay, you heard about this?
Yeah,
this I'm not gonna just do chemo and be suffering miserable the rest of my life. I'm gonna ride it out." Yeah, guess what? Here's a big check. Do something fun with it.
Yeah. enjoy
doing that. So yeah, no, that's why I have mine. And
yeah, no one. Yeah, everyone thinks they're invincible, gonna live forever until we don't.
Right.
So, and then one last thing before we wrap this episode up today. But what do you think about like planning your final expenses, which is like your funeral costs? Like the average funeral cost, it's like anywhere from $7,000 to $14,000, depending upon the type of funeral you want to get nowadays. And all that costs, whether you know it or not, is going to go on to your family when you pass away.
Yeah.
So making sure that you're preparing for those final expenses, whether you get buy your burial bought ahead of time, or we help people with the final expense insurance policies that will pay your family tax free to help cover your burial costs, so that they're not burdened by that. Because a lot of times people will have health issues, might be in a nursing home for a while. It just drains your bank account. You just don't have savings, and then you pass away and you have nothing. So it's just being prepared, and like I said earlier, like the earlier you get it, the cheaper it's gonna be. As the more affordable it's gonna be, you're not gonna see a huge increase. And a lot of times it's like the slice of a pizza every month. Like depending upon your age, like the cost
Your
of age.
Yeah.
Obviously it depends on the size. But like 14 grand, like it's not gonna cost you too much to have it. It's just good to have.
That's
Just
the
in case.
shit. It's similar so you can have a higher amount.
Yeah. The sooner you get it, the cheaper it's gonna be.
Yeah. Yeah. Like for me having it, I'm not even thinking about.
Yeah.
Yeah. Some
There
thinking
you
about
go.
the grandkids that aren't around yet.
Their kids are for their family, but yeah, planning ahead. Insurance is more like your financial defense. So making sure that you are we're defense.
Term.
Yeah. Well, maybe you're like investing in other stuff that we don't help people with, but that's more of your offense. So we help defend and protect what you already have. So that's the goal of insurance.
We need to get a Medicare crypto annuity.
That sounds like a scam.
It's aggressive planning.
Yeah, no. Yeah. But for episode up then, so
That's it.
yeah. I mean, do you have anything else you want to talk about today?
No, I don't. I'm actually fighting off stomach pain. I told you about my lunch incident. Yes.
Yeah.
It's working its way back at me.
All right. Well, we better wrap this puppy up here. So we thank y'all for. Yeah, no, we thank y'all for watching. If y'all want a free Medicare review, we will have a link either in the description or the bio or somewhere around here if you look around to be able to book a review with a licensed agent here. If you're at the Medicare team, if y'all need anything, please let us know. Have any questions, any thoughts, anything at all, please book an appointment. It's free consultation. We get paid no matter what plan we put you in. We're brokers, so we represent a bunch of companies, and our job is to put you in the plan that will best help you out. So
Yes, no ulterior motives on company fund. I had somebody ask me that.
yeah,
Like, oh, well, you're trying to steer me into a email. I'm like, no, not like at all.
yeah,
Quite the opposite, but you know what I mean? If it works out that would be something that would be in your best interest,
yeah,
then yeah, absolutely. I'm going to recommend it to you.
yeah,
Yeah, free consultation though. That's the big
yeah,
thing. Don't be afraid to call in and talk to somebody. Just
Yeah.
get your thoughts. Like, be open about like what you have going on. If you have health conditions,
yeah,
let us know, because it's better for us to like look at your. Some people are reluctant to do that. They don't want to say, oh,
yeah.
they come to find out they have a heart condition 10 minutes
Yeah.
down the road that they're hiding.
Yeah, it's because these companies are going to go into your medical record and see it. So
Right.
we aren't like the people that are going to deny you your coverage. Like we're here to try to get you into the best possible coverage without those delays. Yeah, if we get a fax improvement for sure.
Yeah.
Yeah. Anyways,
Overtime, huh?
sweet. Anyways, without insurance industry jargon, we thank you all so much for watching this episode today, and we hope that you'll join us again on another episode of the Medicare Team podcast.